I lost my self-respect, I lost my self-esteem, and I was very suicidal. It was very, very challenging for me.
Army veteran Natalie Hodge tells me she tried taking her life 6 times after leaving the military.
Those were very dark moments for me. Again, I didn't believe in who I was. I lost my identity.
After many years of suffering, Natalie found light in her life through therapy. She now has a full-time job working for the federal government, finds stress relief working out and walking her 2 rescue dogs.
Let's go this way.
But what she can't imagine is if she was still in that dark place, already feeling alone and isolated, and on top of that, dealing with a global pandemic.
I had sentenced myself to a wall-less, doorless prison in my brain. So being at home right now, if I was not in a better place in me, that's the total recipe. That's the total recipe to take your life.
So Natalie has organized Zoom calls with her veteran groups to talk about these concerns. And this is what she tells me she hears. It's coming from people who have put their lives on the line to serve our country. And now they say they feel more alone than ever, and they're afraid to reach out for help.
Being alone definitely is very, very challenging. And when you don't feel that you have any resources, that's what hurts the most.
Do you think the VA is doing enough right now?
I think I've been seeing a lot of emails, and that's really encouraging to have those. What about the ones that don't have email?
She feels regular phone calls would be an even better way to reach this vulnerable population. We brought the idea to Dr. Matthew Miller, the director of VA's suicide prevention program.
Yeah, it's a great idea, and definitely agree.
He spoke with us from rural Michigan, where he's isolating at home with limited internet quality.
There's one aspect of it that says, hey, call us, we're here. But there's really another very important and necessary aspect, which is backing that up and reaching out, not just waiting necessarily for that call to come in.
Miller says the calls are coming in to the Veteran Crisis Line. At the start of March, less than 1% of them were COVID-19 related. The numbers kept increasing. By the end of that month, between 20 and 25% of the incoming calls centered around the coronavirus. According to the VA, they are adapting. They've encouraged telehealth and video visits, sent out millions of texts through the Vet Text program, added resources to the crisis line, and transitioned those 700 staff members to telework.
The safer that our staff are, the safer that the mission is for the Veterans Crisis Line.
Is the VA doing enough during this uniquely challenging time to make sure it is reaching out and helping veterans?
I think that we're on the front edge of this. Also, though, always willing to watch, learn, grow, and improve along the way.
Now Miller explains the VA is also looking into increasing the capacity for telehealth and video connections. As Natalie continues to connect with her fellow veterans, she appreciates the recognition this is a work in progress.
Us as soldiers, the one who's given our lives, giving our time for our service, for this country, more does have to be done.
If you get just one thing from this story, it's this. If you need help, the Veterans Crisis Line is still answering your calls during this pandemic. Here's the number to call, 1-800-273-TALK. And if you're a veteran, then press 1. Laura Geller, WUSA 9.